So now we are going to go through the CareTouch portion of the objective on its SOAP note format. Um, Basically, we're going to start with pretend it's an initial E&M. Go ahead and click that one. If you had vitals done already, you can just click on exam constitution with vitals on that upper left. Follow through for inches for height, weight, BMI, pulse, blood pressure, um, side of the arm, and then it will go ahead and input the information. The little phrase about he's average build, clean, neat, well dressed, well groomed is the automatic phrase that goes in. What you can do is click on that hyperlink where the blue text is. If they are very specifically athletic or slightly underweight, you just unclick what you don't want and go ahead and click what you want, just like that. Other remember always prompts you to change something. Either you're going to erase it because you didn't do it, or say they're in pain. Okay. So the next set of red buttons are going to be different exam areas of exam. So orthopedic, your red leaves to more. There's a whole list of orthopedic buttons. So say we do a cervical orthopedic, their standard within normal limits are the ones with pain. So if max compression was normal, see, sometimes it will prompt you to have your cursor in the right area. Orthos, maximum foraminal compression performed, patient indicating no pain, but say Sperling's or shoulder depression was painful. Then you can rate the intensity of the pain for the patient and on which side. And then if there's specific levels, if there's not specific levels, you can just go ahead and click that, and if it's just local pain that radiates. And then because we took out that specific spot, you can just edit the chart. Same thing, so distractions within normal limits, Soda Hall, and Valsalva. Pretty easily indicated. And then say Bacody's less radiating pain on the right. And then I'll just kind of prompt you with more questions. Like I said, you can always skip the questions and just make sure it reads kind of properly. So that's orthopedic. So we can click back up here, and if there's neurologic. So with neurologic, you can click individually, mental status, sensory pain, gross, light touch, DTRs, motor testing, cranial nerves. Each one line by line. If you did all of them, there's this neurological upper extremity only and lower extremity only, and then a master neuro with upper and lower. So if you tested all of those things for upper extremity, just go ahead and click the top neurological upper extremity only, and then populate your findings. So normal findings with all upper spinal segments, gross touch or vibration within normal limits, and then what segments were they normal. Light touch, let's say it was decreased, and then you're just going to put on which side it was decreased or what dermatome. And then it will populate automatically DTRs and motor testing as normals. So 2 pluses are 5 out of 5. Safe cranial nerves are all normal. Those will also automatically populate. As you can see here, your neuro starts right about here. So mental status, alert oriented ×3, and cooperative dermatomal normal findings at all upper spinal segments. I'm just going to increase this so it might be a little easier to see. There we go. Evaluations performed indicated normal limits for gross touch vibration, but light touch you had was decreased at the right C5. And then, like I said, neuro for DTRs and upper extremity isometric motor testing automatically puts in the standard normal. So if you do need to change it, it's a blue hyperlink. You can just click it pretty easily. Like that. Same with the muscle testing. if it's just a 4 out of 5 or so. And then at cranial nerves, we chose normal. If they are abnormal, you can just click they're compromised, and by clicking the 1 through 12, you can change exactly which one is deficit. So say it's just ocular motor, and then it will read as such. So that is kind of standard neuro. They also have pathological. So if you do have any Romberg's or dysdiadochokinesia, ankyclonus, you can put this in. So if they have a sway with the Romberg's, you just say to what side, and we'll fill it in for you. Same if there's a Babinski sign, you did that, and if it's present on both sides. Then if it's not, you could have just easily clicked again and put it's absent. So that's neurological kind of quickly. We'll go back to the exam, and if you want to do musculoskeletal findings, there's muscle tonicity, edema, inflammation, any trigger points, and then they do have subluxations and spinal asymmetries. If you never want to use those, we can pretty easily delete them, or you can just not click on them. Kind of depends on what you want. But say there's moderate muscle tone, and it's a little bit hypertonic, and we can go to the left, and let's say it's left, biceps and brachioradialis and coracobrachialis, and then I'll just fill in kind of whatever your findings are. Same with edema, it's just going to put edema instead. So there's mild edema on the left, kind of biceps again. Same thing. If you wanted these in combination, tonicity and edema and inflammation, there's this button up on the right where it says tonicity, edema, inflammation areas. You'd click that one. Tone is going to be, same thing, your questions as what you just saw. And then tone general area, say it's that, left shoulder. Edema intensity, mild. And then that left shoulder again. Inflammation mild, and the same areas, so that way it'll just write it out quickly, kind of more with static palpation. So that's kind of the brief overview of MSK findings. Ranges of motion, if you do them, cervical range of motion within normal limits, or with pain, or any of them with pain, it's always going to list what's the standard normal, so that way you can easily change it. Just like that. And if some do have without pain or stiffness, just again you can uncheck and recheck any of the blue hyperlinks. So that's pretty standard across all the ranges of motion. The next thing we'll go to is a PEDS exam. So they give basic PEDS, developmental PEDS, neurological PEDS. And once again, if you just click one of these buttons, it'll populate the information. If you click a red button, it gives you more options. I don't know what exams you do, so I'm leaving everything in there. If there's certain wording that you want to change or anything, really easy to do in the setup. So I'll go back to your initial exams. There's X-ray evaluation. If you click down this bottom left of views, it'll give you what views are taken. In the plan section, we'll have a views ordered section, but say views happen to be taken today, and you are evaluating them yourself, basically for DJD or whatever, and you just want a quick statement, it's pretty easily written in there. We'll go initial exam, any special tests. These are pretty wordy when you write one out, but if you're doing something in office, there's your example of a A1C test. Patient tolerated procedure well without incident. But if we're not using these, pretty easily to take them out as well. I skipped over the exam systems within normal limits a little bit because it's not something I've completely written or double checked over. I'm sure you're going to have more areas of examined areas, like maybe it's a thyroid specifically, or eye exam, etc., that we need to add in. But that's easily done. This is just to kind of show you what standard setup is like. So if I click head, eyes, ears, and and throat, kind of your standard SOAP words will be written in. If you need to change any of them in setup or anything, again, easily do. If something is different, then we can just click add normal findings, and you can, again, free type, whatever you see in your exam. I would, if we do want to change things so that you have a little bit easier time of changing this, we can do that as well. But kind of cardiovascular set up the same, neck tissue palpation is the same, respiratory, kind of all gives you that kind of standard area. Skin, once again, these blue ticks will populate. So it says for a full body. If, say, you only checked the head, neck, and right and left arms, you'd click on that. And then if there are remarkable findings, you could just fill them in. If there are remarkable findings that you want an extra box within things, we can add easily. And again, my cursor wasn't in a proper field. It was in one of these blue hyperlink fields, so just make sure you find it. And then instead of clicking one of these at a time, if you did do all of the examined systems like that, oops, instead of one at a time, you can just click the master systems review if your cursor's in the right field. And it will populate within normal limits for all 7 of those, and then you can just easily edit it. I'm sure we're going to have to add some more examine systems, specific ones that you do, just let me know, or the wording you want, or I can, I have a physical exam Bates textbook also. I can just pull them up and see what the standard is for those. But so far, that's pretty much the objective and exam portion of CareerTouch.